Welcome to the Extraordinary Health Podcast from All Seasons Integrative Health with your host, Dr. Paul Beckham. We're here to find the root cause of your health condition and help you to finally feel good again. At All Seasons Integrative Health, we utilize full-body chiropractic care and the latest cutting-edge physical medicine therapies, as well as functional medicine to help you live your full potential.
Hello, everybody. I am Dr. Victoria Lau, and with me, Dr. Paul Beckham. And we are here to talk about plantar fasciitis today.
Everybody's most exciting topic, right?
Yes, the feet.
Pain and defeat. Oh.
Yeah, exactly.
Start off with some bad jokes here.
Mm-hmm. So tell us about it. What is plantar fasciitis to begin with?
If you have plantar fasciitis, it's not a joking thing. It's something that can be debilitating for people, especially if you're someone who's got to be on your feet a lot, and especially for runners. So runners can run into plantar fasciitis, especially, if they're kind of new runners. That could be, a huge issue in them either continuing to run or, just obviously not running at all. And usually the big issue is, we got to get down to the root cause of what is causing the plantar fasciitis. So,
And I can attest to that. I had plantar fasciitis in college when I ran track, and I could not wait for our indoor season to be over so I could break and heal. I needed it. I cried my last run. I was thankful that it was over with.
Yeah, it's definitely something that can really have some, even long-term consequences there if you don't take a break from some of that stuff. I mean, it's literally going to cause you issues with the biomechanics of your feet, and start throwing that off. And then that ends up, once you have problems with your feet, and your feet are, the foundation basically of your whole skeletal structure. And, once you have problems with your feet, it's going to start throwing off more things up above. So typically people will start to have problems in their knees or their hips or even up into their spine. And it really can get tracked all the way back down to their feet as far as a structural issue.
Mm-hmm. Now, plantar fasciitis in general, would you say it's based biomechanically, or is it something that just can happen out of nowhere, with that inflammation that goes on?
I mean, usually it's probably an overuse type syndrome. I mean, whether that be acute overuse, from something like starting a running program or something like that, or just kind of chronic overuse where you're, like I say, in a job or position where you're on your feet all day long, usually on a very hard surface, because your body, and especially if you don't have shoes that are supporting your feet properly, can then end up causing some strain on that plantar fascia there. And then you start maybe getting small little micro tears in there. And pretty soon that just kind of builds up and builds up and builds up. And it seems like it was just one thing that happened. Well, all I did was, step on this step wrong here, and I felt something in the bottom of my foot just give me a sharp pain. Well, you might have had that building up over years of just not having your feet supported properly biomechanically. So,
Now, I know we're here to talk about, one of our big modalities at the office, shockwave therapy, that helps it. But what are people doing, or what can people do at home to maybe even, in this case, prevent plantar fasciitis?
Well, if you want to go on the prevention end of the spectrum there, I mean, just like stretching out your body, you kind of want to stretch out that plantar fascia. So a typical exercise that'll have people do is use something like a golf ball. A lacrosse ball can work. It's maybe getting to be a little bit big there, but roll that on the bottom of their foot, just sitting in a chair. So that way you can put as much pressure down on it as you want and roll that underneath the bottom of your foot, trying to get the whole plantar surface, the whole bottom of your foot, just kind of worked out using that golf ball or lacrosse ball. That can help to just break up. Sometimes you might find certain spots that are just tender and you might need to work those over a little bit more. I mean, that's a really simple thing to do at home. Sometimes, as a preventative measure there, just even doing some exercises with your toes, which kind of sounds interesting there, where you You're literally going to put like a towel down on the floor, put your heel on it, but then use your toes to try and pull that towel back into your heel. That's going to help you use some of the muscles like the plantar fascia, to literally help to strengthen them a little bit. And there again, that's a nice exercise there. Even just sitting there with your feet and try and splay your toes out a little bit while you're just sitting there. Just kind of seem like a kind of a hard thing to do.
I'm sitting here doing it, trying to think of doing it.
If you have really long toes, you might even learn how to eat with them. No, but
oh gosh. How about the calves? Now, does that play a specific part? I always remember back in the day they would say, stretch your calves, stretch your calves.
It can. I mean, obviously, if your calf muscles get tight, I mean, it's going to start to restrict the calcaneus, and that's where the plantar fasciitis is attached to as well. So, and that's typically where it does get sore for people, is more back in that calcaneus. You'll hear of heel spurs. That's usually a chronic stress or strain that you've put on the plantar fascia muscles there. And the heel spur isn't the problem. It's the inflammation around the heel spur. So even if you have a heel spur, don't think about having it removed. That's not the problem there. It's the inflammation around it. And that's where we're going to get into our shockwave therapy and how that can help later here. But it's usually the inflammation around that. So if you are starting to get, tight calf muscles, which could be your gastrix muscle, could be your soleus muscle, you definitely still want to stretch those out because you want to allow that calcaneus to move properly there. Some people, if they've had tight calf muscles for a long time, their calcaneus is locked up, and that's where we need to literally adjust the calcaneal bone to make sure that it has the proper motion and movement there, so that when you are just walking on it or running on it, it's moving like it should and allowing the tissue that's the more functional tissue, like the muscles and tendons and soft tissues and all that, to work correctly and not get stressed or strained and break down.
Mm-hmm. So you heard that right, folks. Your feet can be adjusted.
Yes. That's more my specialty here. Yeah. I mean, here's a simple fact. I mean, how many bones in each foot?
Too many.
26. How many joints?
Oh, gosh.
33 joints. There's a lot there. And in fact, if you get into your talus bone in your foot, it's the only bone in your whole entire body where there isn't a tendon attached to it.
Crazy.
Fun facts about the feet.
Yes. Fun facts. So we talked about inflammation a bit there. Would people or individuals want to ice, heat, a little bit of both in this condition?
I mean, usually if it's an acute injury, I mean, just with almost anything in your whole body, for that first 24 to 72 hours or the first day to 3 days there, you're probably going to want to put some ice on it. It's going to help keep the inflammation under control. That's what we're really looking at trying to do here. You're probably not going to make it go completely away, but at least it keeps it calmed down to a point where you're not getting things like compartment syndromes and stuff like that going on, where you just get too much inflammation and then you need to literally have, a surgery, which I've seen some people with like shins where they've just gotten just really bad adhesions in there, and they end up they get a compartment syndrome because they've hopefully not put heat on it, but they have to get that released to the point where the tissue can function normally. Otherwise, you're going to actually kill the tissue off there. It's hard to do that with the plantar fascia because it's predominantly tendon. There is a little bit of muscle tissue in there, we'll say, but it's mostly tendinous down there. So it helps keep, the arch of your foot supported properly there. And that's where we'll talk probably about orthotics here as well. You want to have a functional orthotic. You don't want to have an orthotic that's like a crutch, because you still want your foot to move through its normal ranges of motions and movement. You just want to support it enough to the point where it doesn't get stressed too much in either direction. Kind of like politics these days. You get stressed too much in either direction, it gets to be extreme. Mm-hmm. That's where we end up having problems. Mm-hmm. If we keep it right in the middle there and, don't go too far, you're going to keep things kind of happy there, and there's not going to be too many people that are going to be unhappy with their feet because they've actually had them supported properly.
Mm-hmm. Now I remember just putting my foot in ice water, an ice bucket. Like that was the easiest way to get it done. It wasn't comfortable, that's for sure, but
Yeah, definitely. I've sprained my ankles enough times too where that 5-gallon bucket of ice was probably the happiest thing that I've ever seen and the most excruciating thing I've ever done. But at the same time, yeah, you can even do hot and cold contrast type things right away as well, because that'll help, pump some fluid, pump blood and fluid in and out of the tissues there, and keep that under control. I mean, that's really what you're trying to do initially there, is just keep that inflammation under control so it doesn't get too crazy there.
Mm-hmm. So keeping that inflammation under control, and you said, pumping that blood, so stimulating that blood flow. So let's talk about shockwave therapy and how that can help.
Shockwave therapy is, and I always tell people it's the most shocking, pun intended, yes, results that we get with patients here. The shockwave therapy seems to cut the healing time down significantly here. I mean, we have people who'll have it done the first time. Typically we'll tell them, maybe expect about a 50% pain reduction, inflammation reduction, but I've seen people, and even how I've experienced it myself, has been about an 80 or 90% pain reduction. And that doesn't matter if it's severe or mild. Then it's just a matter of how severe the condition was and how many treatments that we might need to do with it. So getting to plantar fasciitis, it's a pretty tender subject here. Yes, pun intended again here, but it literally has responded extremely well, and it's really what the focus shockwave was originally intended for use, was for plantar fasciitis. They also did it for Achilles tendonitis, and it would be the most ideal thing to use. I mean, we're probably in a mild case, looking at 4 treatments with it, whereas, moderate cases, probably 8, and severe cases, probably about a dozen visits there. But everybody's different, and we'll adjust it accordingly here. But usually once we get somebody in here and we can take a look and evaluate them and find out what kind of state they're in there, we'll try and give them as accurate a treatment plan as possible here, so that they are prepared for what they need to do to follow through to help get this resolved, so they don't have it coming back. So
now, what can you expect with the shockwave therapy? What is a patient going to feel with that?
Really going to feel? Well, it's actually using sound waves. So a lot of times you're going to hear the machine. It's going to like tick, 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 tick. It's actually like a spark. It's an electrohydraulic therapy. It was originally developed for breaking up kidney stones and gallstones. This has now been tuned for more musculoskeletal tissue here now. And, typically, what people are going to feel, when we run the therapy, we want to be, it is a little uncomfortable. We want to run it like on a pain scale from 0 being, no pain at all, to 10 being excruciating. It's probably going to be in that 4 or 5 range is where we want to kind of keep it there. So that way we know when we're hitting the tissue that you are having the worst problems with, we can make sure that we're running it on that tissue and getting it cleared up for you. That's where people are getting that 80 to 90%, pain reduction, even inflammation reduction with the therapy. But another good treatment effect, from the shockwave therapy is that it's actually stimulating the stem cells in the connective tissue. So it's helping that connective tissue heal. So that's probably the biggest thing, and that's where usually once we run the therapy on you, like if we literally, let's say that you did 4 treatments over about a month, it's still going to be working for at least another month after we're done treating you. Let's say it's more on the severe end. Typically you'd probably do 12 treatments over about 3 months. It's still working for another 3 months after we're done treating you with that. So that way, we might have some follow-ups with you if it was really bad and it didn't seem like it was coming along the way it should. We're going to let you know this stuff ahead of time there. You'll realize it probably as we go through treatment, but most people, it's, like I say, shocking to see how fast they get better with this. So,
And then it looks here. So if you are following along and get our weekly emails, looks like there's been even some research done, particularly with shockwave and chronic plantar fasciitis. One result here is that 68% success rate in relieving pain and improving function in patients with plantar fasciitis. So studies are out there, they're being done, and we of course have that tool here to utilize. And even initially, it's a bit diagnostic initially, to
definitely.
especially search out where that plantar fasciitis is occurring, whether it's more to the front or back area of the foot, and we can search out those specific spots.
And I think a more interesting thing is, the research that they were doing, that's just with shockwave alone. So in our office, we're not just going to use shockwave. You're literally going to get probably your foot adjusted. Like I said before, you got 26 bones and 33 different joints. And if you don't have the proper structural alignment of your feet or the proper motion or movement of all those bones and joints, it's not going to heal up. That's why they're only getting 68%. I think we're seeing, in the 90+% range here of people getting better with this. So if you get in here, we're going to make sure we're going to outline everything that we're going to need to do. If it's adjusting your feet, if it's doing some other soft tissue treatment where, maybe we're using, it's our radial pressure wave. Here we're talking about the electrohydraulic one. I know that's going to get confusing for people here. We have one that's called radial pressure wave, which is another form of shock wave. That is, patients will call it the human jackhammer because it kind of sounds like that. It sounds like a jackhammer. But we can kind of work through the tissue there and break up the scar tissue. Typically, we're not going to use that on an acute, plantar fasciitis, Achilles tendonitis, or anything that's acute in the body, because we would probably be stirring that up and making it worse. I've heard some other places kind of making comments about it, like, why would you use a radial pressure wave on? Well, you're not going to use it on an acute injury here. You're going to probably do things to calm it down first, and it works awesome on that stuff. And some people, that's all we need to use is that. But by using the focus shock wave, the electrohydraulic shock wave, now we're getting deep. It gets penetration up to 5 inches deep into the tissue there, so that we can literally knock out just about anything that is causing problems for you. So, and that's where it's diagnostic in the first place, because we're going to seek out those areas that you're having that pain and inflammation in, and we kind of want to reproduce that. We need the patients to be talking with us when we're running the therapy, so that we can locate that and get it knocked out for you. That you're going to get the best treatment when we know that we're running it over the area that's reproducing some of the symptoms that you had when you've been experiencing things like plantar fasciitis or Achilles tendonitis. And, that's where we can get that resolved, hopefully quicker for you too. So,
So you heard that. It's safe, it's effective, it's diagnostic. You're up and you're about and you're talking to us. So just knowing that, I think sometimes people think shockwave, like, oh gosh, what am I getting myself into? But no, you're alive and well. You're talking with us and you're telling us exactly what you're feeling and where we can focus that care.
Mm-hmm. And it's something where, with shockwave therapy, we want to make sure that we get in there, that we're, like I say, running that over the tissue. We're going to hold that shockwave right on that tissue and, basically kind of blast out any kind of inflammation or scar tissue that you have in there. And it's effective. It's non-invasive. There's no known side effects to it. I've watched some other places where you see people utilizing it, and they want to kind of utilize it like an old-fashioned ultrasound machine, and they just kind of rub it over the area. That's not being very effective with it. Typically, that's an unfocused one as well, and it just covers too wide of an area. And when we have a focused one, we can actually focus it right in on the tissue and get that tissue healed for you.
Mm-hmm. Heal it up right quick so you can get back to running, walking, standing at your job. All the things you need to do and love to do. And, you talked about this study and how this is just using the shockwave. Well, we talked about adjusting, but we do have other therapies that can correlate and help produce faster results too, like the laser.
Mm-hmm. Laser is awesome for pain and inflammation as well. And typically, I like to kind of use the focus shockwave and the laser together, because together they're stimulating just about every pathway that your body needs to produce stem cells. So the laser's using light therapy, and the focus shock waves using basically sound therapy. And the combination of the two has been an awesome thing for the patients that have had it done in the office here. I think, I guess I mentioned a little bit in the beginning here. The other thing we kind of look at is we have a foot scan where we're going to look at the biomechanics of your feet. And we're usually not going to fit a person right away, because if you have plantar fasciitis going on, we don't want to get you orthotics when your feet are not biomechanically as sound as what they should be here. We're going to literally, wait till we're, probably partially through your treatment there. It might be probably 2 weeks to 4 weeks into your treatment, and probably do another foot scan on you there and get a person prescription foot orthotics that are going to help functionally support your feet here. So they're a functional orthotic, not a crutch to kind of support your foot, because that causes more problems in the long term, whereas a functional foot orthotic allows for that proper motion and movement there, and it can make your life so much better. I always kind of tell patients it's like if you needed glasses and you never had glasses, and all of a sudden you go into the optometrist, you find out, oh, you need glasses, and they put you through the test, and you're like, wow, that was like crystal clear, and my eyes, it's blurry, or I couldn't see it at all. Putting in orthotics, and I mean, even the company that we have, you got a year guarantee on these things here, so you have a year to decide if you don't like them. Most people, you're going to know within 2 to 5 days. It takes probably 2 to 5 days to break in. Some people might go out to a couple of weeks, but with plantar fasciitis or Achilles tendonitis, they're going to be an awesome thing for you. I think big thing I've seen is like nurses, who are on their feet for 12-hour shifts at a time. When they've come in and gotten prescription orthotics made here, they're just like, they might not like me for that first 2 to 5 days because it does take time to break into them. And usually it's not when they have acute plantar fasciitis going on. We've gotten them past that. But they feel like it, something might be coming back a little bit here, because all of a sudden now we're supporting things where they should be at, and different tissues are getting stressed a little bit. But about between that 5 days and 2 weeks, they come in, they're like, oh my God, I just worked a 12-hour shift, and I feel like I can work another 12-hour shift. My feet aren't bothering me at all. So that can be a huge thing.
Mm-hmm. Now, you mentioned not getting the orthotic initially with acute. Mm-hmm. So how or when would be the appropriate time? Is that just dependent on care and how fast they're progressing?
Depending on how they're doing and how, if they're getting the inflammation to kind of go down, making sure that they can walk on their feet almost barefoot, so they're not feeling like they're getting that little ping or zing when that plantar fasciitis is getting stressed there. Some people's just painful right off the bat. That's what might take a little bit longer there. In the meantime, we could use things like kinesio tape or kinesiology tape to tape their feet up. So it'd be kind of like having an orthotic, but we're just trying to offload your plantar fascia by putting the tape on there. And that can be super helpful in removing some of the stress so that you can continue to do your normal activities and not have your plantar fascia get stressed again here. So,
oh yeah, that kinesiology tape, rock tape, that's some powerful stuff. You don't think it's doing a ton, which it might not look like it is, but it surely does help, especially just giving your body some light stability with the ability to have blood flow back to the area.
Yep. And just, knowing how to put it on properly is probably the biggest thing there. I mean, I've seen people kind of crank it down. It's like, well, you're not trying to make a cast here.
Exactly.
We're trying to support it so you still have, again, that function there. So.
Yeah, I've seen that too. I've seen, multiple, like, let's throw that tape on there, but you got to put it on the right way too.
It's not like traditional athletic tape. It doesn't go on like that at all.
Yeah.
And I think everybody's had to have seen, the kinesiology tape now. You see all these athletes, and I've even had people say, well, I thought he just had it on there to cover up his tattoos.
Mm-hmm. Mm-hmm. Yeah, the rock tape and the cupping that we've been seeing often now.
Yeah.
Well, that's awesome. So we have lots of availability for different ways to help secure plantar fasciitis in a way that you can perform and function the way you need to in life. Any last words, Dr. Beckham, or advice?
Don't let your feet defeat you. No.
That's a good one. We got jokes for days.
Yeah,
everybody. Well, yeah. Let's end there. Let's talk more. If you have questions on plantar fasciitis or anything else with your feet, of course, give our office a call. Continue to follow along with the Extraordinary Health podcast on your favorite streaming services. And we hope to see you in care so we can help you get you back on your feet again.
Ba-bam. Have a good day, guys.
Bye-bye.
Bye.
Thanks for listening to the Extraordinary Health Podcast. For further information or to set up an appointment, go to the website at www.allseasonsintegrative.com or call us at 701-356-0016.